Welcome to the Community Health Centers of Burlington. We're happy to share the following information with you about our history, locations, programs, and services. In 1971, the People's Free Clinic opened in a tiny storefront in Burlington's Old North End. Announcing a new kind of healthcare, the People's Free Clinic founders envisioned a mission that would make a resonating statement. Every person, regardless of age, race, class, or gender, deserves good medical care despite their ability to pay. Staffed entirely by volunteers, including 2 local physicians, the small clinic saw 50 people per week by the end of the following year, often treating minor wounds, providing health information, and sick visits too. Soon, the clinic would strengthen its commitment to grow, and in 1980 became the Community Health Centers of Burlington, or CHCB. CHCB was officially awarded the federal status of a Healthcare for the Homeless Program grantee in 1989, and today remains the only organization in Vermont with this designation. This ensures completely free access to healthcare for individuals and families experiencing homelessness. CHCB was then designated Vermont's second federally qualified health center, or FQHC. As an FQHC, we are required to offer services like the sliding fee scale, a financial assistance program which determines the amount a patient pays based on the amount they make, up to 200% of the poverty rate. Even if you have insurance, if you have a high out-of-pocket deductible, you may still qualify for assistance from the sliding fee scale. Also, as an FQHC, we are required to have at least 51% of our board of directors comprised of patients, ensuring those who are approving our policies at the highest level are in the best position to give feedback on the patient experience. In 2001, we moved into the space that would become our flagship main facility on Riverside Avenue. And in 2004, we began offering dental services. It was at this time we also opened our school-based dental center. This serves any uninsured or income-qualifying student in the entire Burlington School District. This removes not only financial barriers to dental care, but transportation barriers for parents without vehicles or time off to take their kids to appointments during the day. Part of our homeless healthcare program is also our Pearl Street Youth Health Center for patients ages 10 through 30. This location specializes in serving at-risk or homeless youth totally free, providing them access to medical, dental, and counseling services at no cost. In 2009, we received a generous and competitive federal grant to renovate our Riverside location. We demolished and rebuilt the space into its current form in 2012. The tremendous growth of this new Riverside Health Center allowed for more than 400 new patients per month to make CHCB their healthcare home. It also allowed us to increase our programs and services, notably integrated psychiatry and counseling and treatment assistance for patients struggling with alcohol and drug use disorders. During the same year, CHCB established our first rural practice in Grand Isle County, ensuring access to care for 3 surrounding towns after the sole physician in the area retired. This practice transitioned to a new site in South Hero in November of 2016, operating as the newly renamed Champlain Islands Health Center, and expanded access to care even further for residents of southern Grand Isle County. 2016 also saw the addition of Burlington Primary Care, since renamed our South End Health Center, and welcomed Good Health Internal Medicine in South Burlington to the CHCB family. The following year, the South End Health Center added a dental center, transferring dental operatories from the Safe Harbor Health Center. Throughout the year, CHCB collaborated even more with community partners by establishing the Permanent Housing Program at Beacon Apartments and the Bon Vouloir Medical Respite Program for individuals experiencing homelessness. Winooski Family Health joined CHCB as our 8th location in May of 2017. Located in our medically underserved area, this partnership extends the federally qualified health center services to their patient base while uniting our already aligned missions of care. Throughout all of the facility's growth, specialized programs like our maternal child health program and our transgender health program have flourished. We created a BU specialty clinic for the broader LGBTQ+ community, as well as a child psychiatric consult clinic for external providers to refer to CHCB's specialty and availability. In 2020, CHCB met the global pandemic caused by COVID-19 head-on. From testing to vaccinations, CHCB's staff rose to the occasion and worked tirelessly to meet the ongoing needs of their 30,000 patients. A soft introduction of telehealth technology throughout the prior year allowed CHCB to quickly respond to the immediacy of COVID-19. By mid-May of 2020, nearly 85% of CHCB's total scheduled visits were via telehealth. Additionally, we began offering curbside visits to enable access for acute needs while further ensuring the safety of staff and patients alike. CHCB partnered with the state of Vermont to offer COVID-19 testing and vaccines with a focus on reducing disparities throughout the community, from rural clinics in the Champlain Islands to BIPOC and LGBTQ+ focused clinics in Winooski and Burlington. Additionally, our homeless healthcare program outreach team utilized their brand new CHCB van to ensure community members experiencing homelessness or living in emergency housing in hotels or motels had equitable access to testing and vaccines. CHCB's story is one of continued growth, now caring for over 30,000 patients. As the community need continues to grow, so does CHCB. Community members and partners look to us to do what we do best: provide affordable, quality, comprehensive healthcare to all who need it, regardless of financial status or life circumstance. Together with our community, we look forward to many more decades of careful stewardship of our remarkable mission.